More than 4 years since COVID-19 was declared a pandemic by the World Health Organization in March 2020, fear of another mass outbreak looms large. The WHO on August 14 declared the current upsurge of Mpox in Central Africa as a global emergency requiring urgent action. The global concern for the virus grew as it spread to other African countries. And within no time, the deadly strain of Mpox, Clade 1b, crossed the African continent to reach Sweden, Pakistan, and other countries. The virus has killed more than 500 people so far, mainly in the Democratic Republic of Congo, where the disease has been spreading since last year. The country, in fact, saw more than 96% of the world's roughly 17,000 recorded cases of Mpox this year. Though India has not reported any cases yet, the central government is keeping a close eye on the situation. But what is Mpox? Mpox, also known as monkeypox, is an infectious disease caused by the monkeypox virus. It manifests with a painful rash, swollen lymph nodes, and fever. The virus spreads through close contact with infected individuals or animals, with transmission possible via skin lesions, direct skin-to-skin contact, and proximity to an infected person. In fact, Mpox is a zoonotic infection. Fatal in some cases, the WHO first declared it a global emergency in 2022. The WHO decided to change the name of monkeypox to Mpox in November that year, following racist enunciations towards some communities. But let's tell you, Mpox virus can be categorized into two clades, Clade 1 and Clade 2. The first, which is found mainly in Central African countries, is more severe and has a high mortality rate. Clade 2 has milder symptoms and is found in Western Africa. The latter caused a public health emergency in 2022, wherein some 300 cases, though mild, were reported from Sweden. This time, it's the newer and more serious Clade 1b, identified in September last year, that has been driving the current outbreak. Though experts worry that Mpox may be as dangerous as COVID-19 or the swine flu, there is a difference in the nature of transmission. Both COVID-19 and swine flu were highly infectious because they were airborne. In contrast, Mpox is transmitted through close skin-to-skin contact, talking or breathing close to an infected person, or using their soiled clothes or bed sheets. But how do you spot Mpox? Mpox is also like a viral infection with COVID-like symptoms like coughing, fever, muscle weakness, flu-like symptoms, to name a few. It has some fundamental differences from corona, including the fact that Mpox affects facial and outer features of a person, including lesions filled with pus. The Mpox rash often first appears on the face, hands, or the feet, and then spreads to other parts of the body. But in cases linked to the outbreak that started in 2022, the rash often started in the genital area, mouth, or throat. The Mpox rash goes through many stages. Flat spots turn into blisters, then the blisters fill with pus, scab over, and fall over a period of 2 to 4 weeks. You can spread Mpox while you have symptoms. But what are the preventive measures that you can take? Number 1, avoid close contact with people who are diagnosed with Mpox, who have signs and symptoms of Mpox. Number 2, clean and disinfect high-touch surfaces. Number 3, very similar to the pandemic days of COVID-19, always wear a mask that covers your mouth and nose. And number 4, wash your hands frequently with soap and warm water.
If you like this video, then like, share and subscribe to Mirror Now.